We will start our pep talk now. It's already 2 o'clock. So, welcome all. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of your companions who are also attending and watching the pep talk. Use the chat box to ask questions and make comments while the pep talk is on. There'll be a group pictures at the start and end of the pep talk, so please show your face in the video. As a reminder, please take the online Learning Cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown below. Okay. I have placed the link in the chat box and also in the Facebook page and also in the Viber group. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now and show your face. Okay. 1. Ready? 1, 2, 3. Page 2. Ready? 1, 2. Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. What I have in mind in my pep talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. I launched this pep talk on May 15, 2021 with a module on COVID-19. The second module was on patient empowerment. The third module, patient management process. The fourth module on rights in patient empowerment. We're now on our fifth module, staying healthy and contented. There are 5 parts to this module: introduction and intentional living plan, healthy lifestyle plan, which we took up last week, screening and periodic health check, early diagnosis and treatment, first aid, and basic medical care. So my pep talk today is entitled Staying Healthy and Contented, specifically on screening and periodic health check. The empowerment objective is for lay people to have an understanding of the use of screening and periodic health check as a strategy in staying healthy and contented. We have heard of various terms such as executive checkups, annual physical examinations, screening, surveillance, periodic health exam, periodic health check, etc. All of them have one thing in common in terms of purpose. That is, looking for a disease that may be present in apparently healthy and asymptomatic persons. Let me try to dissect and collate the various terms. Screening is the most encompassing term that signifies an action to try to detect potential health disorders or diseases in people who are apparently healthy and do not have any symptoms of a disease. The goal of the screening is early detection of diseases so that they may and can be treated also early enough to avoid disability and death. Screening can be done only once, one time, meaning on a one-time basis. It may also be done repeatedly, as in periodically, every so often, the periodicity of which may be determined based on the risk factors of the patients, such as occupation, age, family history, etc. The recommendations of the organization is also another indication, and also the wish of the patients. The annual physical examination, or APE, that is popularly being used in the workplaces and schools is an example of periodic screening. Other screening programs that are being done periodically are the so-called executive checkups and cancer screening packages. Executive checkup is a health screening program, originally or historically speaking, being done for executives or people with senior managerial responsibility in business organizations. The phrase is still very popular up to these days, even if the screening program has been extended to just anybody, the common tao, the common people in the community. Hospitals and clinics are still use the term executive checkup to market their health screening programs. There are different packages of screening executive checkup. Cancer screening packages are those screening programs being recommended by different medical organizations and government institutions intended for the early detection of different types of cancer. Examples are the screening packages for breast cancer, colorectal cancers, prostatic cancers, cervical cancers, etc. Periodic health check and periodic health examination are terms that have started to be commonly used in the medical world to refer to the periodic screening instead of the traditional executive checkups and annual physical examination. These terms encompasses all past and current screening health programs such as executive checkups, annual physical examinations, cancer screening program, etc. Except for the newborn screening program, in the Philippines, all existing screening programs are not mandated by law. Again, except for occupational, travel, and organizational requirements, subjecting oneself to a screening program is voluntary. I repeat, it is voluntary. There may be recommendations from the medical organizations and government health ministries and peddling by hospitals and clinics, but the decision rests on the individual persons. So it's voluntary. The phrase medical surveillance, how does it differ from the medical screening or screening? Screening can be up-leveled to medical surveillance, where the connotation is that there is a need for close monitoring with screening. Medical surveillance is usually done in the following situations. One, after something unusual is found on screening, there is a need to closely observe or monitor the findings found on initial screening in order to get to a more definite diagnosis. Second, after a definitive medical condition is found on the screening, there is a need to closely observe or monitor it, as it does not require an active treatment at the moment, or the so-called expectant management or watch and wait management. The third indication is that after a treatment of a definite medical condition or disease has been done, regardless of whether this medical condition or disease was found or screening or not, and there is a need to closely monitor and observe for persistence or recurrence of a medical condition or the disease. Example are the medical surveillance for cancer recurrence. After patients are being treated for cancer, there is a medical surveillance for cancer recurrence. How does WHO or World Health Organization define screening? In 1994, WHO defined screening as the use of presumptive methods to detect and recognize health risk or asymptomatic disease in apparently healthy individuals in order to permit prevention and timely intervention. Screening is performed to categorize members of the general public into those with higher or lower probability of disease, with the former group being urged to seek medical consultation or attention for definitive diagnosis and treatment. A question commonly asked, should I have periodic health check or periodic health examination? The answer can be yes or no after removing the legal newborn screening, occupational, travel, and organizational requirements. The answer is yes if you and your trusted physician have assessed that you, generally healthy, have a higher risk for developing a particular disease because of a strong family history. Some would use age as an indication. If there is a high incidence for a particular disease in a certain age group. If you should undergo screening, screen only for the identified disease at risk. The answer will be no if you and your trusted physician have assessed that you, generally healthy, do not have a higher risk for developing a particular disease as compared to the general population in your age group. Other reasons for no answers, studies have shown that general or routine health checks had not, I repeat, had not reduced morbidity and mortality, neither overall or for cardiovascular like stroke, okay, heart attack, okay, or cancer causes. So studies have shown that general routine screening have not reduced the morbidity and mortality. Okay? So the practical recommendation is to be selective using the risk-based approach. Other reasons for no, just like in curative medicine, the biggest pitfall in disease prevention, which is screening is a strategy, is that things that ought to work do not always do so. Even the strategy of screening has its failures. The presence of false positive results in screening tests has many asymptomatic patients wrongly labeled as being ill. So instead of improving the quality of life of people, this phenomenon of false labeling has been found to wreak havoc on the social, psychological, physical, and financial stability of the unfortunate individuals with false positive results. Furthermore, false positive results often lead to a battery of expensive and unnecessary follow-up procedures. The presence of false negative results can give a false assurance that everything is okay, which may lead to complacency, may lead to ignore or minimize new symptoms that may occur in the future. A lot of times, an ounce of prevention translates to just an ounce of cure. So if you don't go for periodic health checks or periodic health examinations, just make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. So with these strategies, you still have an opportunity to catch the disease early. So the answer to this question, should I have periodic health check? So not always, as there is another option of promoting early diagnosis aside from periodic health check, the so-called symptom-based early health check. I will discuss symptom-based early health check in the next session under early diagnosis and early treatment. For today, I will be focusing on screening and periodic health check. As I said, it is used for people who are asymptomatic, apparently healthy, who are screened for early detection of diseases so that they can be treated early enough to avoid disability and death. I will elaborate on the general methods, specific methods, tests, and utility. I may make comments on advantages and disadvantages. Let's start off with the myth. So myths are believed by many but are not true. So one myth is that screening and periodic health check must always be done with laboratory tests and x-rays. No, it's not true. They can be done without laboratory tests and x-rays, such as physical examination and risk assessment interview. So you can do screening with physical examination and risk assessment interview alone. The other myth is that screening and periodic health check done with laboratory tests and x-ray are always conclusive and are always more accurate than without tests. Again, it's not true, because there are also false positive and false negative with laboratory tests and x-rays. Thus, they are not always more accurate. The general screening methods commonly done in the Philippines and even elsewhere, okay, are the following. Okay. Without the use of gadgets, the other one is with the use of gadgets. Okay. So without the use of gadgets, you just rely on risk assessment interview and physical examination, or just physical examination is another screening method. Another screening method without the use of gadgets is just risk assessment interview without physical examination. And then those with the use of gadgets, you can combine this with risk assessment interview and physical examination, or without risk assessment interview and physical examination. So what is meant by gadgets? Gadgets includes instruments used on top of the inspection and palpation of physical examination of the physician, such as thermometer, the use of blood pressure apparatus, stethoscope, otoscope for the ear, nasopharyngoscope for the nose and the throat, ophthalmoscope for the eyes, endoscopy, blood examination, imaging procedures like ultrasound, x-ray, CT scan, MRI, nuclear scanning, etc. So when you say risk assessment interview, it just means asking the patient or the person to explore for possible presence of significant risk factors for a medical condition or disease. Physical examination means examination such as inspection or palpation of the body of the patient or person using the 5 senses of the physician without the use of gadgets. So in this particular method, without the use of gadget, just risk assessment and physical examination. Okay, so shown here are these 2 arrows here. Okay, and then for the without use of gadget, just physical examination. Okay, an example here is the annual PE in schools, which are commonly done. Okay, up to now, I suppose. Okay, but without lab tests, just physical examination by the school physician. Okay. Without the use of gadget, just risk assessment interview and no physical examination. This can be done, but not as effective as those with physical examination. An example, a typical example here, just screening for using the risk assessment interview. So you ask the patient, do you have history of contact in this age of pandemic, okay, with COVID-19 patients? If there is a high risk for COVID infection. Okay, the patient is most likely asymptomatic at the moment. So that's an example of the use of, without the use of gadget, just based on the interview. Now, comparing the effectiveness of these 3 methods, okay, the best will be that with risk assessment interview and physical examination, because the physical examination can explore and investigate risk assessed in an interview. Example, in a patient with risk assessment interview, one found that there is significant risk for breast cancer in this particular patient who is 50-year-old female. Okay, so if you add the physical examination to the screening, so the physician doing the physical examination will allot more time now and effort on the breast for possible breast cancer. Another example, risk assessment interview showing significant risk for stroke in a 60-year-old male. So when doing the physical examination by the physician, he will allot more time and effort on the neurologic examination and also an examination of the heart, especially the heart rhythm, etc. So this is what is meant by among the three. If you don't use any gadget, no, doing risk assessment interview and physical examination is still the most effective. About with the use of gadgets, okay, with or without, two methods, with or without risk assessment interview and physical examination. Comparing the effectiveness of the two methods, again, risk assessment interview and physical examination with screening gadgets is better because findings on the interview and PE can be correlated with those on the gadgets to reduce the problems of false positive and false negative conclusions. And comparing the cost effectiveness of the two methods, gadgets with risk assessment interview and physical examination is better as the latter will rationalize the use of former screening gadgets. Okay? That is done only when indicated as dictated by the findings on the risk assessment and physical examination. Examples of screening gadgets being used. As I said, thermometer will be used for temperature, blood pressure apparatus, blood pressure, weighing scale, the weight, stethoscope, heartbeat and breathing, otoscope, the ear, examining the ear, nasopharyngoscope, nose and throat, ophthalmoscope, eyes, blood examination, the blood content, urine, the urine content, and then endoscopy. Any part of the body can be scoped, okay, by inserting a tube, okay. Imaging procedures, just like X-ray, nuclear scan, can also be done for any part of the body. So all of this can be done once or repeatedly as indicated. So example of use of thermometer, which is used to identify fever. Okay. So screening for possible COVID-19 infection during this pandemic. If there is fever, then you suspect COVID-19 infection. But note here, there are false positive, as not all fevers are COVID-19. And there are also false negative, and because not all COVID-19 patients present with fever. Blood pressure apparatus, this is for screening for possible hypertension. If you have persistently elevated blood pressure above normal, then you are suspected to have, or you're diagnosed to have hypertension. Weighing scale is also used as a screening tool, okay, to check whether a patient is underweight, overweight, and obese, or normal. Blood count, example of use of complete blood count is commonly used, okay, screening for blood disorders, okay. In this test, you may be able to detect anemia, leukemia, and thrombocytopenia. Some thrombocytopenia means there's a below normal count of platelets. Leukemia, there's a unusually high level of blood count on the white blood cells. Okay. So examples of urinalysis. Okay, urinalysis is used to screen for urinary infection and kidney diseases. Chest X-ray, screening for pulmonary tuberculosis. Diabetes, you can use risk assessment interview to check if there's a higher risk, okay, in the presence of family history of diabetes. Then you can also use the gadgets, fasting blood plasma glucose test, or FBS, or fasting blood sugar, or the so-called HG1AC. For hypercholesterolemia, you can use the interview and also the lipid profile, the lipid panel test. Okay. Now, screening method for breast cancer, aside from the interview, you can also do breast self-examination. This can be done by the patient himself or herself, and then the physician breast examination, and then mammography. Okay. Now, for colorectal cancer, some of the screening methods are mentioned here: risk assessment interview, rectal examination, fecal occult blood test, and colonoscopy. For prostatic cancer, risk assessment interview, rectal examination, PSA or prostatic surface antigen. cervical cancer, interview, pap smear, or HPV test, or human papillomavirus test. Okay. For lung cancer, aside from the interview, one can do a low dose CT scan or chest X-ray for screening. So there you are, screening and periodic health check. I have given you examples of screening methods using different approaches: risk assessment interview, physical examination, and the use of gadgets. Again, periodic health check just means the screening is done from time to time at certain intervals, regularly or not regularly, meaning as indicated, as needed. In this era of commercialism in medicine and healthcare, there are a lot of hospitals and laboratory clinics peddling screening gadgets, packages, okay, just like those shown on the right side of the screen. One should understand the indications, the pros and cons of screening and periodic health check. My advice is don't be swayed easily by the marketing and discount offers like those shown here. The most cost-effective indication is still to have screening and periodic health check if there is a high risk for a certain disease. The other indication is to do screening and periodic health check, especially when you have to use expensive gadgets, okay, if there is a good chance for a curative treatment once you discovered a disease. Another advice is to look at the scientific data on the cost effectiveness of screening and periodic health check. So I would advise these two good sources of information: the US or United States Preventive Service Task Force and the Canadian Task Force on Preventive Healthcare. So these are independent bodies. These are not being swayed by the monetary compensations of other factors. Okay, very independent. So let me just cite you some examples on the importance of the use of the scientific data, especially those who are very, very objective. Okay, no biases, no financial interest. Okay. So an example is the use of complete blood count, which is one of the most commonly abused blood tests, left and right. Okay? So the clinical questions being posed has been studied by the task forces. Is there evidence for screening with complete blood count in asymptomatic, those without symptoms, non-pregnant adults, specifying non-pregnant or any adults for that matter? Okay. So the bottom line, the answer here is neither CBC, complete blood count, nor its components should be ordered for screening asymptomatic, non-pregnant adults, as it does not reduce mortality. So up to 11% of the results are abnormal. Okay? But out of this 11, only 1% of the results require management change. Okay. Another example of commonly abused screening tool is urinalysis, which is usually done left and right in all the clinics, in all the hospitals. Again, it is not recommended in pregnant women. Okay. So recommended by the USPSTF. For the lipid profile, those for cholesterol, triglycerides, etc. Okay. So the recommendation by the USPSTF in 2020, okay. So let me just say that this has been commonly abused also. It's most of the time it's being done yearly, okay. And then for all people, okay. So here mentions are those people who are recommended for screening for the hypercholesterolemia, okay. So screen men aged 35 and older for lipid disorders, for women age 45 or older, and then make it every 5 years, okay? Not every year, as is commonly done. Okay? Breast cancer screening, another example. Recommendations by the Canadian Task Force on Preventive Health. In women aged 40 to 49, mammography is not recommended. So what is being done in the Philippines is that almost everybody is undergoing mammography after age 40. Okay? In women aged 50 to 74, mammography every 2 to 3 years is recommended. Again, it's not yearly. If you have to do mammography for age 50 to 74, remember, up to only 74, not up to 80 or 90, okay? Mammography every 2 to 3 years. Okay. So the ultrasound, MRI, CT scan are not recommended for screening. Okay, let me repeat. In this era of commercialism in medicine and healthcare, where there are a lot of hospitals and laboratory clinics peddling screening packages, one should understand the indications, pros and cons of screening and periodic health check. Don't be sold, don't be swayed easily by the marketing and discount offers. So conclusion, takeaway, screening periodic health check is used for people who are asymptomatic, apparently healthy, who are screened for early detection of diseases so that they can be treated early enough to avoid disability and death. Should I have a periodic health check? As I said, the answer is yes and no. Yes, if you and your trusted physicians have assessed that you, generally healthy, have a higher risk for developing a particular disease because of a strong family history. If you should undergo a screening, then screen only for the identified disease at risk. No, if you and your trusted physician have assessed that you, generally healthy, do not have a higher risk for developing a particular disease as compared to the general population in your age group. If you don't go for periodic health check and periodic health examinations, make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. Symptom-based health check, early health check, means that at the onset of symptoms, the patient consults a physician right away for early diagnosis so that a discovered disease can be treated early enough to avoid disability and death. The symptom-based early health check also carries an opportunity to catch the disease early. So a thing that has to be emphasized also, if an early stage disease is diagnosed, whether from the periodic health check or from the symptom-based health check, this should be followed by early treatment to get results. And late treatment by the patient, for whatever reasons, which is commonly seen in our country, for whatever reason, financials and other reasons, or the patient just doesn't want to have treatment, okay, will negate the gain of early diagnosis. So with that, I end my pep talk. Okay. Staying healthy and contented, screening and periodic health check. I hope I have empowered you to have a better understanding of the use of screening and periodic health check as a strategy, as one of the strategies in staying healthy and contented. Okay. So as a reminder before we leave, take the online learning kung evaluation test exercise for mastery of learning and have a perfect score to get a certificate. I'd like to have to make a shout out to these 5 persons who have so far completed all the requirements up to date up to now, inclusive of the homework, the project, advanced directive, intentional living plan, and healthy lifestyle plan. So shout out to Rochelle de la Cruz, Rex Mendoza, Tolentino, Mary Chris Sumalay, Nasesia, Beth Tumambing, and Christina Sara. So let's now have a group picture taking before we start the QA and interaction. Please turn on your video and show your face. Ready? Abol. 1, 1, 2, 3. Page 2. Page 2. 1, 2, 3. Okay. So the floor is now open for questions, comments, okay, and any other sorts of kinds of interactions that you want to have with me, okay, or with among and between the attendees here. Any questions? Any questions? Ladies, can you help me also here? Are there questions?
Yes, Doc. Wala pa ho, wala pang questions sa chat box.
How many are doing screening test almost every year? Screening test means wala kayong symptoms, basta check-up lang. Wala kayong established diseases.
Doc, yung nabanggit nyo yung abuse test like urinalysis, tsaka yung CBC, blood count, ganun. Yung palagi ho akong pag palagi hong binibigyan ako ng ganung test, magpaganyan ka. How frequent ba ho? Kasi halimbawa, nagbi-visit ako ng doctor ng every 3 months. So every 3 months, may mga test na ganun.
Okay, you ask yourself muna, or even because you're not asking your doctors. Okay? You ask yourself, why are these tests being done?
Kaya nga malaking bagay itong lecture, itong pep talk nyo.
Okay.
Siyempre hindi na mangyayari yon dahil tatanungin ko talaga bakit kailangan every yung hindi lang yung urinalysis, hindi lang yung blood count, pati sa yung FBS, kailangan po ba yun at saka yung basta halos lahat ng test. And then you pay 1,000 something every baka masyado nang na-abuse masyado yung test na yun.
Kaya kasi sinabing abuse because it's not really needed. It's not really needed as a routine, di ba? As made known by the international mga bodies saying that you don't need all this test. Or
excuse me.
Somebody's for I bet your voice is coming out. Are you done? Miss Beth? Okay. Okay. So let me, as I said, it's being abused because my basis is that the international body, actually we don't have any local bodies controlling all these tests. Diba? Okay. So the international bodies say there's no need. Okay. So then you ask yourself also, bakit kaya ako ini-examine? And then from your experience, ano lumalabas? So you have been doing this for the past so many years. Ano yung mga results? Normal.
Okay naman ho. Negative naman.
Normal. Okay.
Normal naman.
So, but kaya sabi
Pero
ko,
yung iba, yung like cholesterol, lipid profile, minsan tumataas, minsan bumababa, yung ganun po.
okay. Yeah, okay. Okay, yung baba taas, may comment here, no? Okay, that's why I don't rely too much on those tests that have yung mga results which are nagpa-fluctuate, no? Okay. So, remember, once you have a test on blood chem, yung blood test, no? Let's say CBC or yung lipid profile, no? It won't, if you repeat it, it won't be the same. It won't be the same. Remember that. Nagpa-fluctuate yan. Okay?
Opo.
Okay? So, you take it, let's say CBC, you take it now, then you repeat it after 2 hours, iba ang results. Okay? Nagpa-fluctuate yan. No? Okay? So, but ang tinitingnan na lang yan kasi whether it's within the range of normal. Di ba? Ganon. Pero talagang nagpa-fluctuate yon, no? Okay? So kung minsan nag-fluctuate yan, pag tumaas ng konti lang, matatakot ka na. But once you test it again, di ba, kung minsan pinapaulit ng mga doktor yung test mo ulit, di ba? So kung paulit mo ulit, magiging normal na. No? So kadalasan, wala na katapusan yan. You just keep on repeating. Ano ba talaga? Normal ba ako? Ano? No? Okay? Yeah, that's why the recommendation is kung wala kang symptoms, no, wala kang ano, you don't have to have it test na. Okay?
Okay, okay.
O once you have one test na, huwag nang madalas na, no? Kasi alam mo na eh. Okay? Does that answer?
Thank you, Doc. Thank you, Doc. Thank you very much.
Any more questions?
Meron pong question si Chris N. Hi, Doc, to a patient that has done the chemotherapy medication, what will be the frequency of the follow-up, check-up, and laboratory? Ulitin ko, Doc. From Chris.
But can somebody silence? I bet yung ano mo.
Christy Zars.
Okay. So,
Hi, Doc, to a patient that has done the chemotherapy medication, what will be the frequency of the follow-up, check-up, and laboratory?
okay. So, I'm trying to see where I should focus my answer on this particular question. Frequency of follow-up, tapos may laboratory. Okay. So let's just call it, this will fall under medical surveillance, no? Surveillance for breast cancer. I think, I don't know. Okay, breast cancer, no? Chris specifically mentioned about breast cancer, okay? So surveillance for cancer after treatment, no? After chemo, no? And then you make a monitoring surveillance for recurrence. No? Okay. Okay. Let me iba-ibang approaches dito sa mundo, saka sa mga doktor, okay? There are two schools of thought, no? I will mention first the two schools of thought before I give you my the recommendation by the international body, no? Okay. So one school of thought is you do all the tests, no? To check for possible recurrence kahit na wala kang nararamdaman. Okay? We know that breast cancer commonly spread to the lungs, to the brain, to the bone, to the liver. Okay? Yan apat na area na yan. No? Okay? So kung wala kang nararamdaman, no? So okay. So yung gumagawa ng battery of tests will try to order for tests for these organs, no? So do sa lungs, no? Sometimes they would order for chest X-ray, sometimes CT scan, no? Okay, just to check kung meron pumunta sa lungs mo. Kung sa bone naman, they will order bone scan, di ba? Bone scan, or in the past, before the advent of bone scan, X-ray lang, no? Okay, ngayon bone scan na, okay? Then some would order pa rin yung mga PET scan, di ba? To check kung merong kumalat, no? Okay. Now for the liver, they would do an ultrasound, no? Okay, or even CT scan, no? So this falls under the battery of tests, even when you don't have any symptoms of the recurrence, like pag meron kang symptoms na bone pain, most likely baka meron kang bone spread, na? Kung naninilaw ka, sumasakit ang tiyan mo, baka meron kang spread to the liver. So these are the symptoms that will suggest that you may have some spread, okay? But in the absence of those symptoms, one school of thought is to do all those tests just to check kung meron, because these are the possible presence of metastases or spread. Okay? The other school of thought yung tinatawag na symptom-based directed surveillance, no? Okay? So pumapasok din itong very applicable din nga itong tanong ni dun sa application to what I've been discussing, no? Symptom-based screening, no? So this school of thoughts just would order tests only when you have symptoms of, let's say, bone pain, masakit ang buto mo, okay? Then that's the time they will do bone scan, no? Kung kailangan, no? Now, kung meron kang cough, persistent cough for 1 month or 2 months, no? Kasi sometimes you can have cough, but it's not the cough of recurrence, no? So titingnan pa rin. So may physical examination and history, di ba? Okay? Baka cough ng COVID yan, di ba? Okay? Okay, or flu, di ba? Kung if you have persistent cough for 1 month, no, 2 months, no, now in the background of breast cancer, then the doctor may do test 4D to check the lungs, no, CT scan or chest X-ray, no. So that is what is meant by symptom-based directed surveillance. The first one is battery of tests, kahit na wala kang symptoms, gagawa lahat ng test, no. Okay. So comparing the two, studies have shown that yung pag gumawa ka ng battery of tests, no, you expect, kasi maraming test ka ginagawa every year, year in, year out, no. So chances are, madidetect mo kaagad yung cancer, no, ng earlier, no, compared to symptoms. Symptom-based, mas later mo madidiscover yung recurrence, no. But tinitingnan nila, palagi nila tinitingnan, does it affect the mortality overall, no? So when they make this study, it was shown that these two group of people who went through the battery of tests and also who went through the symptom-directed, they all die at the same time, no? Okay? They all die at the same time. So ibig sabihin, tabla lang. Okay? So yung screening test is not effective also. Okay? Kasi namatay silang parehong same years, gano'n, no? Okay? So ang advantage ng symptom-directed is that the advantage of symptom-directed is the quality of life, no? So hindi ka na madidepress for a longer period of time compared to the battery of tests. Kasi battery of tests, madidiscover mo earlier, patapos madidepress ka lang, hindi ka makagalaw, hindi ka makatrabaho, you cannot live a good life. Then, but you also die at the same time as the one who had a screening test. No? Okay, so that's the reason why these international bodies would always advise just to do the screening, yung symptom-based directed, not the battery of tests. Okay, but of course, again, commercialism in the Philippines, no, okay, even abroad, no, so they do a lot of tests which are not really necessary. Okay. Did I answer your question? Okay. Napasama ko na yung laboratory. Okay. Okay. Any more questions? Okay. So there's a comment by Mel Cabrera. I'm so happy attending this pep talk. Thank you for inviting me. It gives me insight if there's a need for me to submit myself to lab tests. My personal approach is symptom-based directed. But before, remember those who attended my patient management process, I always give you the options. No? I discuss the options with you. Kung anong gusto, I give, let's say, I present the two schools of thoughts, and then I ask you, what do you want? Diba? Okay. So if you choose to have the battery of tests, go ahead. No? Okay. If you choose the symptom-directed, we will follow that. No? Okay. But if you ask me personally, okay, what is my personal preference, I go for the symptom-based, symptom-directed approach. Okay. Symptom-based directed approach. No? Kung may symptoms lang, basta may check-up, may close monitoring. No? Okay? Okay ba, Mel?
Nagre-raise hand, Doc, si Chris.
Okay. Chris?
Hi, Doc. Hi, everyone. Good afternoon.
Okay.
Oo. I would just like to share my case, Doc. No? Siguro maging helpful to. Kasi dito, tama yung dito sa pep talk ni Doc that it's saying that listen to your body. Tapos symptom-based siya. Kasi yung sa case ko kasi, i-share ko lang para maging aware yung ibang kasama natin sa pep talk. Before ako kasi na-diagnose, what happened to me is may slight akong nararamdaman like neck pain, ganyan. So nagpunta ako para mga tries, iba't ibang doctors. Kasi feeling ko may sakit ako sa heart. Yun yung iniisip ko kasi may masakit somewhere sa chest ko na hindi ko naman ma-identify kung saan. And then every time na pupunta ako sa doctor, inaano ako, physical checking through my breast, ganyan. Wala silang nakapa. Then, so ang second na tinetest is my heart, nag-ECG, ganyan. Negative din. So, I feel complacent. Kasi okay siguro ako kasi negative naman yung mga test ko ganyan. After mga ilang months, nararamdaman ko pa rin, doon na talaga ako nag-worry. Lumapit din ako sa company doctor namin. Tapos sabi niya, baka lang yan, yung parang pag nagkakatanda daw mga muscular something, ganyan. So, physical check din niya ako. Yung sa breast ko, wala rin siyang nakapa. So, hindi pa rin ako makontento kasi may nararamdaman ako talagang may nararamdaman ako until one time, naligo ako, may nakapa ako sa breast ko. So, I look for a doctor na talaga na kakilala, na makakapag-refer sa akin, at saka yung malapit na at mapagkatiwalaan, dun na-diagnose na yun yung naging case ko. Yun, kaya maging aware talaga tayo, listen to your body. Yun talaga yung lesson doon. Kasi naging complacent ako dahil sinabi ng mga test okay naman daw ako, healthy naman daw yung heart ko, yung pala may iba palang tinutumbok yung symptoms. Yun lang po. Thank you.
Okay. So that was before you discovered that you may breast mass ka pala.
Yes, Doc.
Okay. So just try to remember what I taught you in the past. No, medicine is inexact. It's not always perfect. No, so you just have to keep on monitoring. No, okay. So you have to monitor yourself, and then you must have a doctor who will monitor you also. No, isa lang. Kasi kung iba-iba yung doktor, wala nang nagmo-monitor sa iyo on a consistency basis, no? Okay. Maguguluhan lang kayo, no? Okay. So once my practice is that once I make a diagnosis, I don't give a 100% assurance that it's perfect, no? That's why I always say check up, follow up, no? Okay. So I use the monitoring to back up my accuracy, no? So after a few days, just a few months, no, makikita mo kagad yung kung talagang may sakit o wala, no? Okay. So don't go may symptoms ka na, don't go to the test right away. Minsan, no? It could be there's such a thing as non-specific, no? Wala naman talagang yung tinatawag na sakit that will kill you. It's not a disease, it's just something that comes out na probably due to environment, no, na irritate lang, no, so which will just disappear in due time. I-adjust mo lang yung environment mo, no. Okay, so wag lang isang kibot na magpapatest na kayo, no. Okay. So unless it's really life-threatening condition, that's why, as I said, you have to listen to your body closely, no, and then ask a doctor, and then ask a doctor who will monitor you also. Hindi lang yung one-shot deal na titingnan ka lang, and after that, bahala ka na. No? Okay, you just come back to me when needed. No? Okay. Okay. Any more questions? Anybody who wants to share screening? No more questions? Ano?
Wala na po sa chat box. Wala
Ito
na
meron.
questions.
What about the risk? What about the risk of testing?
Okay. From Judy, what about the risk of testing during pandemic? When do you recommend going for tests versus postponing for later? Of course, it's been over a year and who knows how much longer.
Okay. What about the risk of testing? The risk of testing, as I said, the risk of testing can be false positive, false negative. That's the risk. Diba? Kaya kumisan, meron pang antigen test mo na, and then may RT-PCR, no? At ibang test. No? Some tests are more reliable than the others. No? So if you go for a antigen test, baka kumisan may false positive, false negative, kumisan talagang true positive, true negative. No? Then, if you go to RT-PCR, medyo accurate, but again, meron pa rin false positive, false negative. No? So, in the end, you still have to go to connect it to your symptoms. Kung may symptoms ka. No? Okay. Kung nagpa-test ka at sinabing positive, pero wala kang nararamdaman, magdududa ka, talaga bang positive ito? So, magpapatest ka. Di ba? Okay. Kasi anxious ka na. No? But if you feel something and then nagpa-test ka, negative. Oh, thank you, negative. Pero hindi pa rin sigurado kung talagang negative. Baka false negative, di ba? Okay. So walang katapusan, di ba? So when do you go for recommend going for test or postponing? Sa akin, as in my lectures before in the COVID, no, if you have symptoms now of upper respiratory tract, simulating the COVID-19. So you just consider at least two diagnoses, yung possible flu or COVID-19. No? But in this pandemic, you have to put COVID-19 as number one. Okay? Remember, yung processes natin for diagnosis is pattern recognition at prevalence. Kung ang very prevalent ang condition ng COVID, you have to consider that as number one. No? Okay. Kung bihira yung COVID-19 at flu ang common, then flu will be number one. Di ba? Okay. So, anyway, ang differentials, when I say differential diagnosis, the two possible diagnoses, COVID-19 or flu, okay, since the treatment is the same, now, I would suggest you don't go for test anymore. Kasi maguguluhan ka rin sa kung positive, negative. Kasi ganun pa rin. It will not change your management. No? So you just confine yourself, quarantine yourself for 14 days, and then just wait. No? Okay. Until you recover. Okay. So I was talking about leaving your I was talking about leaving your house to go for the test. Okay. So just stay home without the test, no? Unless talagang gusto ng local government for you to have the test, no? And then also yung trabaho mo, occupation mo. Di ba sabi ko, yung kung may requirement ng occupation mo, yung trabaho mo, sometimes you are forced to make some move to have the test done. Di ba? Kung wala, you have your choice, wag na lang. Okay. So, di ba yung, then also think of the risk also of having the test kung positive ka. Okay. Pag positive ka, kukunin ka ng LGU, dadalhin ka sa isolation facility na. Okay. Kahit na meron kang kwarto dyan to isolate yourself. Di ba? Okay. So, think of all those, i-balance lang yung pros and cons, benefit, harms. No? Okay. and also factor in the false positive, false negative, and then whether there will be a change in the management or not. No? Okay. Okay. So, tapos na ba ako sa questions? Yan lang. Did I ask? Judy, okay ka na? Did I answer your question, Judy?
Doc, merong isang question dito from Chris again. What is your view on allowing the kids 13 years old to 17 years old to get COVID vaccine?
As I said, I'm not an expert on this vaccination. No? So let's just wait for the recommendations of the WHO. No? Okay. Wait for the recommendation of WHO and also the DOH. Kumitiwala pa kayo sa DOH. Okay. Okay. So I think may lumalabas ng recommendations at pwede yung 13 to 17 years old to get the vaccine. No? But get the official stand of the WHO. No? Okay. So may question.
Doc, may question si Maria Pusta-Pulotan.
Yeah, okay.
Yeah. Good afternoon, Doctor. Doc, you know naman the case of my mom, no?
Yeah.
Ngayon, ako ho, I have had mammography every year since 2007 because it's part of the HMO, the health card. Now, when you reach 50, you have to have this. So, syempre ho, I didn't know you yet, so I went through everything every year. And then since 2015 ho, they added the ultrasound, breast ultrasound. So all the findings have been either negative or benign. Now, since last year, I didn't go because we were all locked down. So since I met you, I have done the breast examination every day I do it. So yeah, I do. Nagpapalpate ako every day. So is that okay? Because I feel fine. And that's what I'm doing now because I'm still afraid to go to a hospital and tell them, well, okay, I want this and that. And with what the talk today, it's put my mind at rest that at least I'm doing something that's better than having that mammo, and it's really painful every year.
Okay. Kasi ganun yun, diba? Kasi you're talking about possible occurrence of breast cancer in your body. No?
Yeah.
Now, you look at your risk factor. Now, your risk factor is that you have a mother who has breast cancer. No? Siya lang. No? Okay.
Siya lang po.
Kasi, but if you have two immediate relatives with breast cancer, mas mataas ang risk mo. Diba? Kung isa lang, medyo run of the mill lang yan. May konting taas lang. No? So you have the option whether to go for the screening test already, no? Because meron kang family history. No? If you decide not to go for the screening test because of the COVID threat, no? You can still do other forms of screening. Okay? Breast self-examination is also okay. And then your physician examination through me, no? Through telemed. Yung telemed ko, pwede naman without
pwede.
No? Now, if you are, let's say, wala nang COVID, wala nang COVID, so ang tanong niya, are you still going for those tests? No? Okay? Are you still going for the laboratory test? Kasi yung isa, kahit na with or without COVID, gagawin mo, breast self-examination, physician examination. No? Okay? So the question is whether you should undergo mammography or ultrasound. No? Okay?
Both nga ho, they want both.
So ultrasound is not, if it's for screening breast cancer, ultrasound is not the tool. No? It's still the mammography. So if you have to do mammography, it should be every 2 years.
Okay.
Every 2 years. Okay. But okay, let me tell you one of the experience that I have with Filipinos patients, especially those with HMOs. They want to make full use of their insurance, di ba?
Yes. Okay. I mean, ako ho, I wasn't aware of that. It was the HMO, again, the OB-GYN who said, "Oh, let's take this test. Sayang naman if you don't take it." So, okay. So I went willy-nilly. I went, and now it was every year because parang wala akong choice.
Sige.
The first ultrasound I took was extremely the first ultrasound I took was extremely painful because it was a big machine.
Okay.
I felt like I was being Xeroxed.
Okay.
That was my feeling. Now that's why I was so afraid the following year, but then it changed. It was just the ordinary ultrasound machine with that scope.
Okay.
It
But
wasn't.
yeah, every now and then there will be changes in the machines and also the readers.
That was
Not only the
awful.
machines but also the readers, huh? Well,
Yes,
the fax
yes,
reader, no?
yes,
So, okay, going back, my stand is kasi we know that mga health care costs is very expensive, di ba?
yes,
Okay.
yes.
So, ideally, pag wala kang HMOs, don't go for it, di ba?
Okay, opo.
But if you really want to utilize the benefit that you may have from the insurance,
Opo.
you can go for it, but make sure to take note that maraming false positive, false negative. No?
Opo,
Take
yes
note of
po.
that, and then ask somebody, an expert, to interpret it for you very carefully.
Yes po, yes. Because they always do that. I mean, I get the results, I bring it to the doctor, the OB, the real doctor.
Yeah, but there are two kinds of doctors. One is maximalist, one is minimalist. One
Okay.
is more what do you call that, analytic or not.
Okay.
A lot of doctors, kahon din sila. Kasi pag sinabi ng radiologist, positive or suspect,
Positive.
they will go along with it. They will go
Okay.
along with it. No? But there are doctors who will just say, wala yan. No, ganun.
Okay.
So take note of all
Okay.
these idiosyncrasies.
At least now I know it's okay. So I'll continue examining myself.
Yeah. Breast health
Thank you.
clinical exam, and then what you try to
Yes.
balance the pros and cons, benefit and risk. No?
Yes.
Okay.
Yes. Okay. Thank you, Doc.
Welcome. Any more questions? I think Jeanette has a question. Huh?
Doc, meron siya pong question regarding full abdominal UTC. How accurate are these as a screening test for the liver, GB, spleen, kidneys, and bladder?
Okay. Yung ultrasound, UTC is ultrasound, abdominal ultrasound. No? Okay. So it can be used to screen diseases inside the abdomen, abdominal kasi ito, no? So you talk about the liver, gallbladder, spleen, kidneys, and bladder, no? So it all depends on the type of diseases that it can detect, no? Iba-iba, no? Sa gallbladder, usually nadidetect niya yung mga stones. Okay? Quite accurate, no? Okay, stones. But not not such thing as 100% accuracy, no? So probably 90% accuracy for those which are easily diagnosed, no? Okay? And then let's say sa liver kung meron siyang tumor, no? Medyo may 90% accuracy 'yon, no? Okay? But it's just yung sinatawag na fatty liver, ganun. Kasi a lot of times they diagnose you with fatty liver, okay? Those are non-specific, no? Matatakot lang kayo, no? Okay? So beware of those interpretation, no? Okay? So yung ultrasound cannot diagnose hepatitis, no? Okay? Sasabihin lang niya malaking liver, but it cannot say it's a Hep B, hepatitis B, hepatitis, no? Ganun. And then spleen, makikita lang yan enlargement or tumor, no? Okay. Kidney, ganun din. It can see some stones, it can see dilatation of the ureter, okay, to suggest some stones, no, some obstruction, or can may tumor makikita, no? Okay. So bladder, ganun din. It can diagnose stones with good batting average of 90% or more. No? It all depends on the size of the tube of the stones also, no? So pwede ultrasound of the, but it all depends on what you're trying to look for. If it's just for screening, sa intestine, hindi ha. Mahina ang ultrasound for the intestine. No? Okay. So if you're going to have screening for your intestine, don't rely on the ultrasound of the abdomen. So to answer, in short, to summarize my answer to your question, how accurate? No, it all depends. No, it all depends. No, on what you're looking for. No. Okay. Any more?
Thank you.
Ana?
Wala na po.
Okay. Our 3:11. It's now 3:11. May pahabol. Okay. May isang may pahabol.
In doing self-breast exam, if some areas are tender to touch, are these okay?
Yeah.
Are
Okay.
these just hormonal changes? Some doctors say that if there is pain, it's okay compared to feeling a lump, which is not painful.
Correct. Correct. Okay. So in some areas, if some areas are tender to touch, these are okay. Okay. Ganun yon sa breast, Jeanette, and everybody. If you palpate if you try to do a screening on your breast by doing breast self-examination, okay, or even the doctors when they do the physical examination of the breast, the main thing that we look for is there a mass. The rest are secondary, okay? Kung may lump or wala, okay? Kung walang lump, if you feel a pain, baliwala yan, okay? 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 So, importante yung may bukol o walang bukol, okay? Now, if you feel a lump, that's the time you suspect possible cancer or not cancer, okay? But if you don't feel a lump, most likely there's nothing there, okay? So the question is if there is pain, okay? If there is a pain, there's no lump, no problem, okay? So as I said, put more importance on the lump, okay? So the algorithm that I use is if there is a lump, there is a problem. It's a red flag. If there is no lump, there is no problem, okay? If there is pain but no lump, no problem. Okay? Okay. So yung sinasabi naman, baka the pain might be due to hormonal changes, tama. Okay. So yung sinasabi ni Janet, some doctors say that if there is pain, it's okay compared to feeling a lump that is which is not painful. Okay. Now, focusing on that particular last question, if there is a lump, okay, if it's painful, masakit na masakit, at mapula-pula, then most likely it's inflammation. Okay? Kaya mas maganda. Okay? If there's a lump that is not painful, no? Okay? Yan ang nakakatakot. Baka cancer, baka tumor. Okay? Ako niyo? Okay? We're now focusing on lump that is painful or not painful. Okay? But if there are other signs, let's say may lump.
After you're freezing.
Ano na? Nawawala?
Nag-freeze ka. Yeah.
Okay na? Okay na?
Better. Yeah, it's better.
Okay. Baka yun ang signal. So there's a lump. The last question of Jeanette is, there's a lump. If it's painful, mas maganda. Okay? If it's not painful, mas nakakatakot. Okay? Okay. But you have to qualify it.
Copy.
So we have to qualify if there's a lump which is painful, pagkatapos meron siyang redness, most likely it's may infection siya. So maganda, no? Okay. Pero kung walang redness, no, mas nakakatakot na 'yon, no? Okay. Okay? Jeanette, can you hear me now? Can you hear me, Jeanette? Ladies, anything? Ladies?
Wala na, Doc.
Wala na, okay. Okay, so it's 3:16. Thank you for all your questions. I enjoyed answering all your questions, although very challenging. Okay. And then
Thank you rin, Doc.
okay. So we'll call officially we'll end this pep talk at 3:16 now. Okay. So those who want to stay can stay on. Okay. And then those who want to leave can leave already. Now. Okay.
Thank you, Doc.
Thank you. So the next topic will be early diagnosis and early treatment next time.
Thank you, Doc.
Welcome.
Thank you, Doc. Thank you so much.
Welcome.
Thank you, Doc.
You're welcome.
Ay po.
Welcome. Welcome.
Oh, thank you, Doc.
Thank you, Doc.
Welcome. Emily, kamusta na? Okay ka? Okay
Opo.
na? Okay
Wala
lang?
na po. Opo, okay na po.
Okay.
Wala na masakit.
Okay. Okay. So,
Okay.
so gusto mo pa ultrasound? CT scan?
Kayo po.
Binibiro lang kita, hindi kailangan.
Okay.
Pag napunta ka sa ibang doktor, ano ka na yan?
Oo nga po, Doc. Thank you, Doc.
You're welcome. Okay.
Okay.
Sige. Keep in touch.
Okay. Opo. Okay, bye-bye, Doc.
Bye-bye. Sino si Jeng? Jeng Amonelo. A new name for me. Jeng Amonelo.
Jeng po, Doc.
Ha?
Jeng De Castro po,
Oh,
Doc.
bakit iba yung pangalan mo?
Doc, yun yung real name ko, Redem.
Ha? Amonelo ang nakalagay. Dati Jeng De Castro.
Opo.
Yes, hindi na pa yung mga pangalan. Kumusta na, Jeng?
Doc, magpapasked ako sa inyo ng telemedical.
Okay. Just tell me when.
Okay, okay po, Doc. Thank you po.
Tapusin mo na yung ano mo.
Doc, isa na lang po. Natapos ko na po yung healthy lifestyle. Yung pong ano na lang ang hindi. Iisa pa. Intentional living plan po. Tinatapos ko pa po.
Okay. That's good.
Opo.
How about the others ulit? Tapos mo na? The others?
Hindi pa rin po, Doc.
Anyway, mas
Gagawin ko po, Doc. Opo.
madali lang yon.
Opo. Babalikan po yung mga yung mga recorded videos tapos saka po i-take yung ulit.
Okay. Abulim na. Baka mag-graduation ceremony na tayo.
Ay. Sige po, Doc. Sige po. Salamat po.
Oo. Kasi 3 na lang no? 2 na lang. 2 session for the course.
Araw-arawin ko na yung mga hindi ko pa po nasagutan.
Baka dagdagan ko pa ng isa. Supplements. Kasi maraming issues sa supplements, di ba?
Opo. Thank you po, Doc. May message na lang po ako. Okay,
sige. Bye-bye, Jay.
Thank you.
Bye-bye.
Bye-bye po.
Okay. So, any more questions you want to know? Lorly, Ricaforte, kumusta ka na? Lorly. Okay. Anong census natin, Abet?
38.
38. Okay. Good. Okay. Wala na. Let's call it a day. So kung wala na, let's na.
Yan pala ay 675.
Si Mary Ann Jose. Mary Ann, magsasubmit ka ba? Mary Ann. Magsasubmit ka, hindi. Matatapos na yung course natin. Hintayin kita o hindi? Unmute.
Magkasubmit po ako, Doc. Promise po. This week po.
Kasi I'm deciding whether I will hold a graduation ceremony. By first week, second week of October.
Okay po.
Para sumabay ka na to kung gusto mong umabot.
Opo, Doc.
Oo.
Nagda po ng mga topic niyo eh.
Okay. Para baka dagdagan ko pa isang topic, yung supplement na.
Dok, alin, tatapusin ko lahat yung
Ibigay ko sa'yo. Bigay ko sa'yo.
Lahat yung Dok, tapusin ko na?
Oo. Yung nakikita mo si Rex Tolentino, tinapos niya within 2 days. Yung mga online niya.
Kasi
Nakahabol.
mali. Dok, wala kasi akong history, kaya nang hula lang, sabi ko, gawin ko na nga ito. Sayang tuloy yung 3 ginawa ko. 4 ba yun? Hindi ko kasi nakita yung history yung ginawa ko.
O, binigay na kita ng listahan, di ba?
Apo, sundin ko na lang po yung Dok.
Sundin mo na lang kasi mahirap balikan eh.
Apo, Dok.
Ang hirap i-keep track yata yung mga estudyante. Okay, there are no more questions. Sige, I'll just sign
Thank you po, Dok.
sign off na ako, ha? Okay. Bye-bye.
Thank you po, Dok.
Bye.